Good day, future doctors. So this is the part 2 of our lecture on histology of the respiratory system. In the part 1 discussion on the histology of the respiratory system, we have already discussed all the organs that belong to the upper respiratory tract. We have discussed about the nasal cavity, the nasopharynx, the epiglottis, and the larynx. We were able to also cover trachea, which is one of the organs that belong to the lower respiratory tract. So for this lecture, we will be covering the remaining organs that belong to the lower respiratory tract. Pointed by the blue arrow is the trachea. At the level of the sternal angle, the trachea will bifurcate to form the two primary bronchi. And as soon as these two primary bronchi will enter the lung tissue, they will form branches, and these branches will be called as the secondary bronchi. The branches of the secondary bronchi will be referred to as the tertiary bronchi. Again, the trachea bifurcates to form the two primary bronchi. Primary bronchi are also called as the main bronchi. And as soon as these primary bronchi will enter the lung tissue, they will form smaller branches. And these smaller branches will be called as the secondary bronchi. Please take note that there are three secondary bronchi in the right lung because we have three lobes in our right lung. And there are two secondary bronchi in the left lung because we have there two lobes. Before we proceed to the next discussion, please take a look at the yellow colored structures. They are representing the secondary bronchi. Count how many secondary bronchi you can find in the right lung and how many can you find in the left lung. 3 in the right lung and 2 in the left lung. The branches of the secondary bronchi will now be referred to as the tertiary bronchi. Let's apply what you have learned on this particular picture. This is the trachea. The trachea bifurcates to form the two primary or main bronchi. And as soon as this primary or main bronchi will penetrate the lung tissue, they will produce smaller branches which we will refer to as the secondary bronchi. Count how many secondary bronchi can you find on the left lung. You have 2, while you have 3 on the other lung. This green arrow is pointing to one of the tertiary bronchus, which is a branch of the secondary bronchi. The secondary bronchi will give rise to the tertiary bronchi or segmental bronchi. Now take note of this. Each tertiary bronchus and its branches will supply a certain portion of the lungs. Again, a particular tertiary bronchus and its branches will supply a certain portion of the lungs. And that portion of the lungs plus the tertiary bronchus and its branches will now be collectively called as the bronchopulmonary segment. This is the trachea. This is one of the primary or main bronchi. This is one of the secondary or lobar bronchi. And this is one of the tertiary or segmental bronchi. Now take note that pointed terminal bronchus and as well as its branches plus the portion of the lungs that it is supplying with air will be referred to as bronchopulmonary segment. These are the different bronchopulmonary segments of the lungs. Take note, each of them has their own terminal bronchus. Now, why is it important for us to know that there are bronchopulmonary segments? So I want you to imagine, we have a patient who has a tumor growing on bronchopulmonary segment number 1 of the right lung. And there's a need for the surgeon to resect the tumor as part of the management of the case of the patient. The other segments will not be affected by the resection of bronchopulmonary segment number 1 because the other bronchopulmonary segments have their own respective tertiary or segmental bronchi. I want you to compare now the diameter of the trachea to that of the primary bronchi, and then to that of the secondary bronchi, then to the tertiary bronchi. You will notice that the diameter of these structures decreases as the air will go from the trachea down to the tertiary bronchi and even up to the bronchioles and the alveoli. Let's have this photo first before we'll discuss the microscopic characteristics of the remaining structures that belong to the lower respiratory tract system. It's important to be reminded that the diameter of the airway passages will decrease as you move from the trachea down to the bronchi, down to the bronchiole, and down to the level of the alveoli. So expect that the height of the epithelial cells will also decrease, because the height will have an effect on the diameter of the airway passages. Expect that at the level of the alveoli, the epithelium there should be simple squamous, because if you will place their pseudostratified ciliated columnar, the height of these cells will cause obstruction in the alveoli. So what is our conclusion in terms of the epithelium? The epithelial cells of the trachea are taller than that of the bronchi. The epithelial cells of the bronchi are taller than that of the bronchioles, and so on and so forth. The number of goblet cells will also diminish. You know very well that goblet cells function to produce mucus. And if you have abundant goblet cells at the level of the alveoli, the mucus will cause obstruction. So might as well make the number of goblet cells decrease as you move from the trachea down to the bronchi, down to the bronchioles, and down to the alveoli. The explanation for the decrease in the height of the ciliated cells of the respiratory epithelium is the same as the explanation I made about the height of the epithelial cells. The decrease in the number of the glands at the lamina propria of these organs is the same as the goblet cells. We will talk about the hyaline cartilage support of the walls of the organs that belong to the lower respiratory tract system. As stated in the photo, the size and the number of these cartilage supports will decrease. So expect to find large and abundant hyaline cartilages at the trachea compared to the bronchi. Now, it's very important to take note that there are no more hyaline cartilages present at the levels of the bronchioles and the alveoli. The question now is, since you know very well that the cartilage functions to provide support, what will now provide support to the bronchioles and alveoli, given that they don't have any cartilage supports anymore? The answer is smooth muscle. And please take note of this. As the number and size of the cartilage supports will decrease, the number of smooth muscles will increase. This is the cross section of the trachea. Take a look at the C-shaped hyaline cartilage. And this C-shaped hyaline cartilage will provide support to the ventral wall and the two lateral walls of the trachea. This is the cross section of a bronchus. What do you notice? You cannot anymore appreciate the perfect C-shaped hyaline cartilage, just like what you saw on the picture of the trachea. Instead, you have here hyaline cartilages in plates. Just like in the case of trachea, the bronchi are also lined by pseudostratified ciliated columnar epithelium or the respiratory epithelium. But take note, as the bronchi will form smaller branches, expect that the height of the epithelial cells will decrease. Primary bronchi are completely encircled by hyaline cartilage, but as soon as this primary bronchi will produce the secondary bronchi, you will now see the presence of the cartilage plates. At the level of the lamina propria, expect to find lymphocytes and seromucous glands similar to that of the trachea. Take note, as the number of the cartilage supports will decrease, the number of smooth muscles will increase. That's why stated in the PPT, also present are smooth muscles, which will become more prominent as you move from a large bronchi to a small bronchi. This is a cross-section of a bronchus. Take a look at these two cartilage plates and take a look at the smooth muscles. These smooth muscles will become more prominent as the bronchi will form smaller branches. This is another cross-section of a bronchus. This is one of the cartilage plates, and this is the smooth muscle. This is the cross-section of a bronchiole. What do you notice? You cannot anymore find a cartilage support. That's why I've told you a while ago that cartilage supports are no longer present at the levels of the bronchioles and alveoli. So it's easy to differentiate now trachea from bronchi to bronchioles. Why? Trachea has a C-shaped hyaline cartilage support. You have cartilage plates at the level of the bronchi, and you don't have any more cartilage supports at the level of the bronchioles. And what is now prominent at the level of the bronchiole is the smooth muscle support. This is another cross-section of a bronchiole. Please appreciate the absence of hyaline cartilage support in its wall. Instead, you have there prominent smooth muscle. The blue arrow is pointing to one of the bronchioles. Take a look at its wall. You don't have there the hyaline cartilages that you can find at the trachea and the bronchi. So bronchioles have diameters of less than 5 millimeters. That's why the height of the epithelial cells here should be shorter than that of the bronchi and the trachea. Bronchioles are formed by the 10th generation of branching of the bronchi. So I want you to imagine one tertiary bronchus. It has to produce 10 generations of smaller branches, and that's the time you'll get to form bronchioles. The lining epithelium will become simple ciliated columnar from pseudostratified ciliated columnar. It has to become simple ciliated columnar because it has to lessen its height. Later on, the lining epithelium will become simple cuboidal until such time that it will become simple squamous at the level of the alveoli. What are now the unique features of the bronchioles under the microscope? There are no cartilage plates in the wall. There is that diminishing number of goblet cells, diminishing or decreasing height of epithelial cells, and you have thicker layer of smooth muscle, which will function to provide support. Shown in this picture are two terminal bronchioles. Please take note, terminal bronchioles are the last portion of the conducting portion of the respiratory tract. Terminal bronchioles will bifurcate or produce branches, and these branches will be called as the respiratory bronchioles. So respiratory bronchioles are formed when terminal bronchioles will bifurcate. Starting from the level of the respiratory bronchioles down to the alveoli, that you will call as the gas exchange portion of the respiratory tract. Please take a look at the picture On the left side, you have here a terminal bronchiole. It's very obvious because you don't have there cartilage support in its wall, and you have the prominence of the smooth muscle. And then you will see in the middle of the photo, this terminal bronchiole will bifurcate, and the branches will now be labeled as respiratory bronchioles. Shown in the picture is a terminal bronchiole. You have there the prominent smooth muscle layer, and you don't have cartilage supports on its wall. And then, as the terminal bronchiole will produce branches, it will eventually give rise to the respiratory bronchiole. The terminal bronchioles are lined by simple ciliated columnar epithelium. Expect to find tall cells with cilia on their apical portion. But there are important cells that are interspersed among these simple ciliated columnar cells, and we call them as the Clara cells. And Clara cells are easily identified because they don't have cilia on their apical surfaces. Clara cells are also called as club cells or exocrine bronchiolar cells. This is a picture of a bronchiole. What we will do now is to view its lining epithelium under high power objective. And this is how its lining epithelium will look like under HPO. We will now shift the objective from HPO to oil immersion. And this is how the lining epithelium of the bronchiole will look like. You have there columnar cells with cilia on their apical surfaces. Interspersed among them are the club-shaped Clara cells. So what are now the functions of the Clara cells? Number one, they can produce surfactants. Surfactants are chemicals that reduce the surface tension in the walls of the alveoli to keep them open so that they can facilitate gas exchange. Another important function of the Clara cells is that they can detoxify inhaled synbiotics. If there are toxic or harmful chemicals in the inhaled air, they are detoxified by the Clara cells. That's the reason why the Clara cells are present in the terminal bronchioles. You know very well that terminal bronchioles are the distal portions of the conducting portion of the respiratory tract system. Beyond the terminal bronchioles, gas exchange will already take place. So to make sure that none of the injurious or harmful chemicals in the air will reach the gas exchange portion, the terminal bronchioles are provided with Clara cells. And these Clara cells will do the last minute cleaning of the inhaled air. Clara cells can also secrete antimicrobial substances which can kill microorganisms present in the air that were not trapped by the mucus produced by the goblet cells in the trachea and the bronchi. Another important function of the Clara cells is that they can act as stem cells. So let's say, for example, the simple ciliated columnar cells of the bronchioles were killed by an injurious agent, then what will replace them are the Clara cells. Clara cells can also replace the cells of the alveoli. So that's how important they are. Take a look at this picture and then look for the terminal bronchiole. As the terminal bronchiole will bifurcate, it will form the respiratory bronchioles. I want you to compare now the walls of the terminal bronchioles to the respiratory bronchioles. Which among them is interrupted by the presence of alveoli? It's the respiratory bronchiole. Please do not forget that one because that will help you identify them under the microscope. Respiratory bronchioles are formed by the bifurcation of the terminal bronchioles. If the terminal bronchioles are lined by simple ciliated columnar cells with interspersed club-shaped Clara cells, the respiratory bronchioles are lined initially by simple ciliated columnar cells, But these cells will decrease in height and they will become simple cuboidal. So that's why the respiratory bronchioles are lined by simple cuboidal epithelium. And these cells will also lose the cilia on the apical surfaces. As mentioned from the previous PPT, the walls of terminal and respiratory bronchioles are almost the same. It's just that the walls of respiratory bronchioles are interrupted by openings to the alveoli. So for you to understand that, I will be showing you some sample pictures. Please take a look at the terminal bronchiole in the picture. As it bifurcates, it will form the respiratory bronchioles. Please do appreciate that the wall of the terminal bronchiole doesn't have any interruption. This blue arrow is pointing to the respiratory bronchiole, and the red arrow is showing you an interruption in its wall, and that interruption is caused by an opening to an alveolus. This blue arrow is pointing to the wall of the respiratory bronchiole, and this red arrow is showing us another interruption caused by the opening to one alveolus. So if you have walls that are interrupted by openings towards the alveoli, then you are looking at the level of the respiratory bronchiole. Let's have another one. This is the terminal bronchiole. As you can see, its wall doesn't have any interruption. And then appreciate its bifurcation, which will produce now the respiratory bronchioles, those that are labeled with letters R. Blue arrow is pointing to the wall of the respiratory bronchiole. Red arrow is showing us an interruption. Blue arrow is pointing to the wall of the respiratory bronchiole. And this is another interruption in its wall. Can you identify the terminal bronchioles in the picture? Can you identify the respiratory bronchioles in the picture? Eventually, the respiratory bronchioles will continue as alveolar ducts. And it's easy to identify the alveolar ducts because of the presence of increasing number of alveolar openings. Take note, at this point, the lining epithelium will become simple squamous. So let's review. Terminal bronchioles, simple ciliated columnar. Respiratory bronchioles, simple cuboidal. Alveolar ducts, alveolar sacs, and alveoli are lined by simple squamous epithelium. This is the terminal bronchiole. This is one of the respiratory bronchioles with interruptions on its wall. If the interruptions will increase in number, you are already looking at the alveolar duct. Let's have another example. This is the terminal bronchiole. This is the respiratory bronchiole. But at this point, you can clearly see increase in the number of the interruptions or openings towards the alveoli. Then, most likely, the area pointed by the red arrow is the alveolar duct. And then take a look at the area labeled as AS. That's the alveolar sac. And alveolar sac is composed of group of alveoli. Please also take note that the alveolar duct is lined by simple squamous epithelium. This is the terminal bronchiole. This is the respiratory bronchiole, and the blue arrow is pointing to one of the interruptions in its wall. And then, this is the alveolar duct. You have there increase in the number of the openings to the alveoli. And this one is pointing to a group of alveoli. So that is an alveolar sac. Alveoli are the sac-like invaginations that you saw at the walls of the respiratory bronchioles, the alveolar ducts, and the alveolar sacs. And they are lined by simple squamous epithelium. and it is in this alveoli where gas exchange usually takes place. And there's an estimation of 300 million alveoli in the two human lungs. This is a picture of alveoli. They are lined by simple squamous epithelium. Alveoli are the reasons why lungs appear spongy on gross examination. This picture is just showing us that the alveoli are provided with abundant elastic fibers so that they can expand during inhalation. Take a look at the structures labeled with number 3. So these are the walls between two alveoli, and the walls will be referred to as interalveolar septa. And these interalveolar septa are formed by two adjacent alveoli. Alveoli are lined by simple squamous epithelium. Do you know that there are two types of cells that are found at the walls of the alveoli? So take a look at the cell labeled with number 1. These are squamous cells, and we will name them as type 1 pneumocytes. And then take a look at the cells labeled with number 2. What do you notice? They are not squamous, they are not flat. Instead, they are cuboidal, and they are called the type 2 pneumocytes. Looking at the picture, it's very obvious that the type 1 is more common than the type 2. The squamous cells that line the walls of the alveoli are referred to as the type 1 alveolar cells or type 1 pneumocytes. These cells occupy 97% of the total alveolar surface. Why? Because these cells are the ones responsible for facilitating gas exchange. And for them to do that, all of their organelles should be found near their nuclei so that they can leave majority of the areas of their cytoplasm as clear or empty, and that would enhance gas exchange. And since these cells are flat and beneath them are numerous capillaries, these cells are provided with tight junctions. Tight junctions function to prevent diffusion of fluids in between the cells. So the tight junctions present in the type 1 pneumocytes or type 1 alveolar cells will prevent the leakage of the fluids in the capillaries towards the alveolar spaces, which will greatly affect the rate of gas exchange. The remaining 3% of the total alveolar surface is lined by the cuboidal type 2 alveolar cells or type 2 pneumocytes. These cells are provided with, number 1, tight junctions so that they can prevent the diffusion of fluids from the capillaries into the alveolar surface, and number 2, desmosomes so that they can form tight adhesion with neighboring cells to keep the wall of the alveolus intact. Another good thing about type 2 pneumocytes or type 2 alveolar cells is that they are mitotically active and they can undergo mitosis to replace type 2 pneumocytes and even the type 1 pneumocytes. So should there be any damage in the alveolar wall, what will replace the cells is the type 2 pneumocyte. Another important function of these cells is that they are the ones that produce the pulmonary surfactant, the chemicals that will keep the walls of the alveoli open so that it can facilitate gas exchange. And that's the very reason why the cytoplasm of these cells appear foamy. It's because they have in their cytoplasm lamellar bodies, which are the precursors for the pulmonary surfactants. So take a look at the cells labeled as type 1 pneumocytes. They are flat or squamous. And take a look at the cell labeled as type 2 pneumocyte. It is cuboidal in shape. Appreciate the foamy appearance of its cytoplasm due to the presence of lamellar bodies. The cell labeled as P1 is the type 1 pneumocyte. It is squamous in shape. And the cells labeled with P2 are the type 2 pneumocytes. They are cuboidal in shape. The cell pointed by the yellow arrow is squamous, so therefore that's a type 1 pneumocyte or type 1 alveolar cell. And the cell pointed by the blue arrow is cuboidal in shape. So that is the type 2 alveolar cell or type 2 pneumocyte. This is a picture of one alveolus. This is the type 1 pneumocyte and this is the type 2 pneumocyte. Present in its cytoplasm are lamellar bodies, and these lamellar bodies will become the precursor for the pulmonary surfactants. And as you can see in the picture, the pulmonary surfactants function to lessen the surface tension within the alveolar walls to keep them open. It is in the alveoli where gas exchange takes place. Oxygen in the air will diffuse through the type 1 pneumocyte, then into the underlying capillary. The capillary is the structure that is filled up with the red blood cell, and it's the one at the tip of the blue arrow. And from the blood in the capillary, carbon dioxide will be eliminated into the alveolar space or air space. And this carbon dioxide now will be eliminated through exhalation. Pointed by the blue arrow are the simple squamous cells of the alveolar walls. And these are the type 1 pneumocytes or type 1 alveolar cells. And since they are part of the epithelium of the alveoli, they have underlying basement membrane. That's basically the characteristic of epithelium. You have tightly packed cells resting on basement membrane. Pointed by the red arrow is the wall of the underlying blood vessel or capillary. Blood vessels are also lined by simple squamous epithelium, and the squamous cells in the blood vessels are called the endothelial cells. These two cells, the type 1 alveolar cells and the endothelial cells, will form what we call blood-air barrier, and the main purpose of which is to not allow the air to enter into the blood circulation, which has a fatal effect. So if you will be asked what is forming blood-air barrier, you have to answer, number 1, the type 1 alveolar cell. Number 2, the fused basement membranes of the type 1 alveolar cells and the endothelial cells. And number 3, the endothelial cells. The blood-air barrier is formed by the type 1 alveolar cells, the fusion of the basement membranes of the type 1 alveolar cells and the endothelial cells, and the endothelial cells of the capillaries or blood vessel. And the main purpose of this blood-air barrier is to prevent the entry of air into the blood circulation and as well as the leakage of blood into the alveolar space or air space. The blue arrow is pointing to a pore that is present in some of the alveolar walls in the lungs. And these pores are called the pores of Kohn, Kohn, and they function to connect neighboring alveoli that are supplied by different bronchioles. So expect that the alveoli with the blue and red stars have their own bronchioles supplying them with air. So what is now the importance of these pores of Kohn? So let's say for example, there's an obstruction in the bronchioles supplying alveolus with the blue star. That alveolus will still receive air from the alveolus with the red star, even if they are not supplied by the same bronchiole. The pores of Kohn are the pores seen in the interalveolar septum. That's what we use to refer to the walls of the alveoli. And they function to connect neighboring alveoli that are opening to different bronchioles. This is another good picture of a pore of Kohn. Please take note of it. The squamous cells lining the walls of the alveoli are called the type 1 pneumocytes. The cuboidal cells lining the walls of the alveoli are called the type 2 pneumocytes. Suspended in the airspace or sometimes attached to the walls of the alveoli are the alveolar macrophages or dust cells. Alveolar macrophages or dust cells are the phagocytes of the lungs, particularly the alveoli. Since they are macrophages, they are derived from blood monocytes. Take note of this. Tens of million monocytes migrate daily from the blood vessel towards the lungs to form the dust cells. Dust cells function to phagocytose airborne particulate matters and even red blood cells from damaged capillaries. These dust cells can be seen attached to the walls of the alveoli, or you may see them on the alveolar spaces. Take a look at the cell that is labeled as alveolar macrophage in the picture. So these cells are seen migrating on the luminal surface or alveolar space in the lungs. Yellow arrow, type 1 alveolar cell or type 1 pneumocyte. Blue arrow, type 2 alveolar cell or type 2 pneumocyte. Red arrow, alveolar macrophages or dust cells. We're down to our last topic. The lungs are enclosed within the pleural cavity, and the pleural cavity is enclosed by two layers of membranes. The first one is the visceral pleura. That's the membrane that is directly in contact with the surface of the lungs. And the outer wall of the cavity is formed by the parietal pleura. In between the parietal pleura and the visceral pleura is the cavity, which is containing pleural fluid. The question now is, where did this fluid come from? This is the parietal pleura, and please do appreciate it has a blood vessel within it. This is the visceral pleura, and you can also find blood vessels in it. The filtration of the fluids in these blood vessels will now form the pleural fluid. And since the lining epithelium that is specialized in facilitating filtration is simple squamous, expect that both parietal and visceral pleura are lined by simple squamous epithelium, just like what is shown in the photo. This is just to prove to you that both the parietal and visceral pleura are lined by simple squamous epithelium. This is the cut section of the lungs. You have in here the presence of alveoli. And then this is the cut section of the visceral pleura. What do you notice? It is found on the surface of the lungs. And then you have their simple squamous epithelium. And that ends my lecture on histology of the respiratory system. Thank you for your attention.